Well, the CDC has monitored a rise in COVID-19 cases in July, and hospitalizations are highest in southern states, including Florida. Now, as the kids return to the classroom across the country, health officials are keeping an eye on a new COVID variant, Eris. Joining me now via Zoom, Dr. Mohammed Reza, infectious disease specialist with Reza Health. Good morning. Thanks for talking with us about this morning.
Good morning. Thank you for having me.
Now, Dr. Reza, you did send us some data from the state of Florida. I want to pull it up because what we'll see is that since May, cases have been rising every single month. So do we know anything about the strain and if this is a dangerous variant or how is it affecting people?
Yeah, so this strain, which is the most common variant that we're seeing right now, this X variant, it is more contagious than the previous Omicron subvariants that we've seen. But the data is not showing that it causes more severe disease, so it doesn't cause people to become more ill than the previous strains and variants.
Okay, so is that the XBB variant that you're talking about, or?
It is, yes.
Okay, all right, so what are the symptoms for this one?
So it's similar to the previous Omicron variants, so it's the muscle aches. That's one of the big things that I've seen with a lot of my patients. It's the kind of all that just bone-breaking muscle ache, fevers, cough. Those have been the main symptoms, runny nose, of course, as well as a loss of taste and smell. So similar to what we've seen previously.
Okay, but as far as that lung infection that was so deadly, we're not necessarily seeing those same types of symptoms with this latest variant.
We're not seeing that severe outcome that we saw with previous strains of this virus.
All right, let's talk about vaccinations, because I know we're going to soon be talking about flu vaccinations. There is another graphic I'd like to pull up, because as we saw the cases ticking up, we are seeing vaccinations tick down according to that same data. So is there a vaccine specifically to protect against this strain? And if not, how should people think about the timing as far as getting vaccinated or boosted?
Yeah, so the FDA has said that they're coming up with a vaccine that's specific to this strain, but it will be available sometime this fall. So it's not something that's available right now for people. For those that are fully vaccinated and immunocompromised, getting that booster shot at least 6 months out, and if you're truly immunocompromised, you can get a second booster as well. So that's what's still recommended. But all the other tools that we've talked about previously are still very effective in preventing this infection, right? So hand washing, keeping some of that distance, doing things outdoors. And the other big thing is if you're sick and you're not immunocompromised and you have mild symptoms, get tested, because that will not only protect you and allow you to gain access to medications, but also those that are more vulnerable around you, people that are elderly, people that are immunocompromised.
Okay, let me ask you, because there is a message being circulated right now talking about COVID. I received the text from a number of people asking me if it's real, but it talks about this X variant, saying that it's 5 times more toxic, is what the wording said, than past variants, encouraging people to double mask and to keep spreading this word. So the data we just saw, it does not support that. And we're always trying to dispel misinformation. So aside from vaccination, what do you think people should be doing to stay healthy? And again, you said that text message is just false.
It is. It doesn't cause more severe disease, but it is more contagious. That's what we're seeing. The other big thing is if you are symptomatic with this virus, please talk to your provider, because there is very good medications to decrease the risk of ending up in the hospital, especially if you're immunocompromised and you're symptomatic. There are very good medications that the government's made available for free almost. So it's get on those medications, and getting on them within 5 days of symptom onset is when they have the best effect and outcome. So talking to your providers and getting tested, those are still the cornerstone of how we can control this.
All right, great information. I mean, I think the key here really is to talk with your doctor and don't keep spreading that text message, because again, it's false. Dr. Reza, thank you so much for clearing things up for us this morning.
Of course, thank you.